Health Minister Christine Elliott is defending the $348,000 salary for former hospital president Reuben Devlin atop a six-figure public pension in his new role devising ways to end hallway medicine. The retired orthopedic surgeon, former president of the Progressive Conservative Party and friend of Premier Doug Ford, was named to the patronage post 2 weeks ago following the PC government's first cabinet meeting. Sources said Dr. Reuben Devlin is in line for a pension of roughly $300,000 per year after retiring in 2016 as the longtime president and CEO of Humber River Hospital. Richard Loudon's Toronto Star: "It's important that we keep costs in mind as we go forward, but I'm sure that what is going to come forward is of great benefit, both in terms of cost and of patient care," Elliott told the Star. "What we're looking at is what he can bring to the table. And, yes, he has been running a hospital for a number of years. He was very involved in the construction of the new Humber Hospital, which is pretty much a digitized hospital, and that's what we need to look at for the future." As longtime president and chief executive of Humber River Hospital, from which he retired in 2016, the well-regarded Devlin earned about $500,000 a year, which puts him in line for a pension of roughly $300,000 annually, sources said. Article continued below. Devlin declined to comment. Read more. Ontario Tories point man on healthcare wants more innovation. A year ago, Christine Elliott was a patient of the health system she now oversees as Minister. Opinion: Hepburn, Ford's cynical display of political patronage of double-dipping, of a hefty salary and similar-sized pension is appalling given Ford's mantra of respect for taxpayers, NDP leader Andrea Horwath said of Devlin's 3-year contract to solve hospital overcrowding that results in patients being treated in hallways, lounges and even washrooms, often in peak flu season. Over 3 years, that's $1 million. That would employ a number of nurses to try to help deal with our hallway medicine crisis, added Horwath, who noted the Conservatives frequently slammed the previous Liberal government for taking care of its own. Article continued below. Mr. Ford's going to have to explain why his insiders are better than Kathleen Wynne's insiders. The bottom line is I want to see the changes on the front lines where people are able actually to get quality, dignified health care in our hospitals again." In early May, Ford railed against the Liberal governments of Kathleen Wynne and Alton McGuinty in a pre-campaign debate at City TV, and he has criticized high public sector salaries on the annual Sunshine List of workers earning more than $100,000. After 15 years of Liberal mismanagement, scandal and waste, it's time for change, Ford said in the May debate. "We have seen this Liberal government make sure that they have taken care of their Liberal insider friends, and Liberal insiders, lobbyists. But we can tell you one thing, my friends. We will make sure we bring government that respects the taxpayers. You know me, I'm for the little guy." Ford frequently mentioned Devlin on the campaign trail as a key health advisor and named him to the new government's transition team. Devlin told the Star's Teresa Boyle last month that he's eager to introduce more innovation to this system. Ford promised during the campaign to spare the province's massive healthcare budget from cuts but said his government would redouble efforts to find more efficiencies within it. The Star story: Devlin said the Conservatives have the political will to modernize our system by creating real integrated care, and called the new Humber facility, whose development he shepherded, the Hospital of Tomorrow. Elliott said Devlin's expertise is welcome as he builds a council of experts. He's got a lot of experience in healthcare, both in terms of hospital management and looking at innovation, and so we are looking at him to work with me and to advise the Premier of how we find those efficiencies, how we use that innovation to make sure that patient care is strengthened, she said. Devlin makes more than Ford, who earns $208,974, and Elliott, at the standard cabinet minister's salary of $165,851. Rob Ferguson is a Toronto-based reporter covering Ontario politics. Follow him on Twitter, @RobFerguson1.